The last thing you want to find in your toilet is a worm, but what if that worm is long, skinny, has a pointed tail and is coming out of your mouth? Welcome to my channel. Today we will be counting down 20 scary facts about Ascariasis. Number 20. Where did it come from? Ascariasis is caused by a type of roundworm called Ascaris Lumbricoides. The adult worms live in the intestines of infected individuals. These worms can grow up to 35 centimeters or 14 inches in length. Adult female worms can lay up to 200,000 eggs per day. Eggs are then passed through the host's feces into the environment. Number 19. A soil-transmitted infection. Soil-transmitted helminths, also known as STHs, are nematodes that are transmitted through contaminated soil. These worms include Ascariasis, hookworm and trichuris. Ascariasis is the most common type of soil-transmitted helminth infection worldwide. It is estimated that 807 million people are infected with Ascariasis. Of those infected, 60 million have significant lung involvement. Number 18. A global problem. Although Ascariasis occurs worldwide, it is most common in tropical and subtropical regions. This is because the warm climate provides optimal conditions for the survival and development of the worm eggs in the soil. In these areas, the eggs can survive in the soil for years and can easily be ingested by humans. In temperate climates, such as in North America and Europe, Ascariasis is much less common. However, it can still occur in people who have recently travelled to endemic areas. Number 17. Who does it affect? Anyone who comes into contact with contaminated soil is at risk of contracting Ascariasis. Children are particularly vulnerable to this infection because they often play on the ground and put their hands in their mouths without washing them first. Farmers and gardeners are also at high risk because they work directly with the soil. Number 16. How many people are infected? Worldwide, more than 800 million people are infected with Ascariasis, making it the most common soil-transmitted helminth infection. Most infections occur in rural areas where people are more likely to come into contact with contaminated soil. Number 15. How is it spread? When a person accidentally ingests Ascaris eggs, the eggs hatch in the small intestine and migrate through the intestinal wall into the bloodstream. They travel to the lungs where they mature into adult worms. Once the worms have matured, the cycle continues when the female worms lay their eggs, and the eggs are coughed up and swallowed. The eggs then pass through the digestive system and are excreted in the feces. Number 14. Symptoms of infection. Many people infected with Ascariasis do not experience any symptoms. When symptoms do occur, they can include abdominal pain, nausea, vomiting, diarrhea, and weight loss. In severe cases, a large number of worms can cause intestinal obstruction. If the worms migrate to the lungs, they can cause pneumonia-like symptoms such as coughing, wheezing, and difficulty breathing. Number 13. Diagnosis of Ascariasis. Ascariasis is diagnosed by identifying the eggs of the parasite in a stool sample. This is done through a process called fecal flotation. During fecal flotation, a stool sample is mixed with a solution that makes the eggs float to the top. The eggs can then be identified under a microscope. Number 12. Treatment of Ascariasis. Fortunately, Ascariasis is easily treated with a single dose of an anti-parasitic medication called albendazole. Albendazole is available as a tablet or liquid. It is important to note that albendazole should only be used under the guidance of a healthcare professional. Number 11. The history of Ascariasis. Ascariasis is one of the oldest known parasitic diseases. It is mentioned in ancient texts dating back to 2000 BCE. At that time, it was believed that the disease was caused by evil spirits. It wasn't until the late 1800s that Ascariasis was identified as a parasitic infection. Number 10. Common misconceptions. Despite being easily treatable, many people still hold misconceptions about Ascariasis. Some believe that the disease is caused by dirty habits, such as eating with unwashed hands. Others believe that the disease is a punishment from God. These misconceptions can lead to stigma and discrimination against those who have Ascariasis. Number 9. Stigma and discrimination. People who have Ascariasis may face stigma and discrimination from others in their community. This can make it difficult for them to seek treatment, and can lead to further health problems. In some cases, people with Ascariasis have been forced to leave their homes or even been banned from certain activities, such as religious ceremonies. Number 8. Prevention of Ascariasis. There are several simple steps that can be taken to prevent Ascariasis. These include washing hands thoroughly with soap and water, especially before eating, avoiding playing or working in contaminated soil, wearing shoes in areas where soil contamination is a problem, and regularly deworming children. Number 7. Deworming. Deworming is a public health measure that is recommended for people who are at risk of Ascariasis. In many countries, children are routinely dewormed at school. In other countries, mass drug administration campaigns are carried out to treat people who are at high risk of infection. Number 6. The life cycle of the parasite. The life cycle of the parasite that causes Ascariasis is complex and involves several stages. Once the eggs are ingested, they hatch in the small intestine and migrate to the lungs. In the lungs, they mature into adult worms and mate with each other. After mating, the female worms produce eggs which are coughed up and swallowed by the host. The eggs then hatch in the small intestine, and the cycle begins again. Number 5. Superinfection. Superinfection occurs when a person becomes reinfected with the same parasite shortly after the initial infection. This can happen if the person does not fully adhere to the treatment regimen or if they are exposed to a new source of infection. Superinfection can lead to more severe symptoms and may require a longer course of treatment. Number 4. Malnutrition. Ascariasis can contribute to malnutrition, especially in young children. This is because the worms compete with the host for nutrients. This competition can lead to stunted growth and development in children who are already at risk of malnutrition. Number 3. Comorbidities. Comorbidities are pre-existing medical conditions that can make Ascariasis more severe. For example, people with HIV/AIDS or other immunodeficiency disorders are at increased risk of developing severe Ascariasis. Number 2. Drug resistance. Drug resistance is a growing problem in the fight against Ascariasis. When the parasites become resistant to the drugs that are used to treat them, it can be more difficult to cure the infection. This is a serious public health concern, especially in areas where Ascariasis is widespread. Number 1. Research gaps. Despite the fact that Ascariasis is one of the most common parasitic infections in the world, there are still gaps in our knowledge about the disease. For example, we don't know exactly how the parasite is able to evade the host's immune system. We also don't know why some people develop severe disease while others don't. These research gaps mean that we are not able to develop more effective ways to prevent and treat Ascariasis. If you enjoyed learning about Ascariasis, then make sure to check out our other videos on parasites. You will be horrified at the things that are living inside of you. Click the video on screen now to continue watching.